The tongue, they say, holds so many secrets in the body. What if your tongue is trying to tell you something about your health? Now do this little exercise. Turn on your webcam, because I know you're watching me on a digital device. Turn on your webcam and take a look at your tongue. A healthy tongue is supposed to be reddish. That's indicating oxygenation and blood flow. It's supposed to have a thin layer of white coating. And it's supposed to have little tiny bumps called papillae. It's supposed to be moist. It is also supposed to be able to freely move and should not be painful. Now, if your tongue is red and smooth with no bumps, that's the papillae I mentioned, you may have glossitis. Glossitis is a condition caused by a nutritional deficiency of vitamin B12. This deficiency can happen if you have an autoimmune disease that prevents absorption of this particular vitamin. I also like to add that vegans are at risk of glossitis, so remember to take your vitamin B12 supplement. Now, if you notice that your tongue is big, this is called macroglossia. If your tongue is big and it hasn't always been like that, how do you know your tongue is big? If you can see imprints of your teeth on either sides of your tongue is big. If you've always been like that from birth, it's probably congenital. But if it's actively growing, it may show that you are allergic to something, or it's probably an infection. If it keeps growing, you'd have to go to the hospital, because if it gets bigger, you'd have difficulty in breathing. So I know you took a look at your tongue. I want you to answer this. How much can you see the back of your mouth? If you take a look at your tongue and it has a thin white coating, which you normally wear off when you brush, this is pretty normal. However, if this coating is thicker and is cheese-like, there are 4 suspected causes. The first is oral thrush or oral candidiasis. This is a yeast infection which causes raised patches of cheese-like material on the tongue. This cheese-like material, if you try to rub it off, you'd notice that the tongue is irritated and may likely bleed. This can be caused by taking antibiotics medication. So oral antibiotics medication can actually disrupt the bacteria in the mouth, leading to growth of this yeast infection. There are other things that can cause an oral thrush. Diabetes too can cause an oral thrush. And you can also see this in immunocompromised individuals, like people that have compromised immune systems, as seen in conditions like HIV and AIDS. If those patches are dry and flakier, this may be leukoplakia. That is plaques that developed because the tongue got irritated. You may want to keep track of that and treat as important, as it can turn into cancer real quick. Now, if it's lacy and has a burning sensation to it, this may be lichen planus. Lichen planus is related to the immune system, but can be treated with steroids. If those patches are seen on one side of the tongue, this is called hairy leukoplakia, and it is seen in people that have compromised immune system, like people that have HIV. There are movements that your tongue is supposed to be able to do: rolling, clover leaf, twisting left and right. Now, if your tongue isn't able to do most of these movements, you may have conditions like Raynaud's syndrome and scleroderma. Also, a strawberry tongue is an indicator for scarlet fever, a group A strep that causes strep throat. It is also an indication for Kawasaki disease. Kawasaki disease is a serious disease that happens in children under 5 that causes inflammation of blood vessels. These kids get really sick with symptoms like fever, red eyes, swollen and enlarged lymph nodes. The next one is a geographic tongue. The cause of this is not known, but it must be related to the immune system because it's seen in conditions like psoriasis and asthma. The good news is this naturally resolves on its own without medications. The next on my list is Sjogren's syndrome. Sjogren's syndrome is an autoimmune disorder that causes dry eyes and dry mouth. People with Sjogren's barely make any saliva. This has negative impact on their dental health and also causes their tongues to get cracked. This syndrome is very rare, and some medications can also cause a dry mouth. This is a hairy tongue. It's not made of real hair. It is made of a buildup of keratin. It can take any color depending on what is happening in your mouth and should naturally go away with brushing and scraping. Being a smoker is a risk factor. The last one is a canker sore, also called aphthous stomatitis. These are small painful sores that are not contagious and naturally go away on their own. Now, if you have recurrent canker sores, or you also have a lump on your tongue, you may want to get it checked for tongue cancer. Risk factors for this are smoking and HPV, that is human papillomavirus. We've come to the end of this video. Thank you for staying to this point. And if you've not subscribed, what are you waiting for? Please subscribe and leave me a comment. Thank you so much. I'll see you in my next video.